On the first night after surgery in particular, you may be woken up every hour by the nurse to check on your breast reconstruction. If we detect any sign of problems, we can return you to the operating theatre and attempt to salvage the reconstruction. In many cases this is successful, and overall at Queen Victoria Hospital, more than 99% of our breast reconstructions using the patient's own tissue go on to be successful. With a DIEP or muscle-sparing tram reconstruction, you do need to be prepared for fairly long scars on the abdomen. Typically, the scar on your tummy will run from hip to hip, and we try to make it low enough so that it is hidden in most types of underwear. There will also be a small scar around your belly button. Usually the scars from surgery settle very well with time, but in some patients they can go on to become red and lumpy. If that does occur and persists, there are treatments we can give you in clinic to help with this. Other common complications include seroma, which is a collection of fluid, usually in the abdomen, but sometimes also in the breast. This again can usually be dealt with in clinic. Wound infection can often be treated with antibiotics, but if severe, may require you to come back into hospital. Another complication of all surgeries is bleeding. Usually bleeding would occur, if severe, within the first 24 to 48 hours, so you would still be in hospital, and we would deal with it by taking you back to the operating theatre and stopping the bleeding. It is very rare for patients undergoing breast reconstruction to require a blood transfusion. At Queen Victoria Hospital, we have implemented an enhanced recovery pathway for patients undergoing free flap breast reconstruction, such as a DIEP or muscle-sparing tram flap. This helps you to recover faster after surgery, and we start the work towards this before you even come into hospital. When you attend the pre-assessment clinic, you will be given some special drinks to drink in the day leading up to your surgery. These are carbohydrate-rich drinks, which will help your recovery from a long anaesthetic and procedure. You will also be given some compression stockings to wear and injections to thin the blood. Both of these things are designed to reduce the risk of blood clots following surgery. The first injection, we will ask you and show you how to give yourself at home the night before surgery. You will then have a week's worth of injections after you go home. As part of our enhanced recovery pathway, we encourage all patients to get up and about from the first morning after surgery. If you feel up to it, you can even have something to eat now on the evening after you've had your surgery and woken up fully. Most patients will then recover and go home within 2 to 4 days. This is sometimes limited by drains, which are there to drain any residual fluid after surgery, but we now try to remove all the drains if we can within 48 hours of surgery. Your urinary catheter, which is inserted in your bladder during the surgery, will be removed on the first post-operative morning. This will make it easier for you to get up and about. One of our consultants here at Queen Victoria Hospital has developed a national registry of all women undergoing breast reconstruction using their own tissue. We may therefore ask for your contact details so that you can be contacted at various intervals following your surgery to see how happy you are with the reconstruction. The data that comes out of the National Registry will be important in future to inform women who are considering this type of reconstruction. So we hope that you'll be able to help us with this.
I will be coming round to see you on the day after your surgery. You will have had a bit of a disrupted night, but the point of our visit to you is first of all to check your chest, because it is a long surgery, so that we want to make sure that you're not retaining any secretions, and that we'll be giving you some breathing exercises. The next thing that we will be doing is that we will be helping you to get out of bed, and the reasons for this are because it will help with your breathing, it will also help drain the drains, and it will get you independently mobile so that we can take away the dreaded catheter. The next thing that myself or one of our team will be doing is going through a range of movement exercises for your shoulders, because it's a natural instinct when ladies have had this operation is to guard the breast and not be moving the shoulders correctly, and what we don't want you to get is a stiff shoulder after your surgery. So they're very basic exercises, just putting the shoulder through all the range of movements, and for different types of surgery there will be different types of exercises. So we will have gone through all of your exercises and we will have got you out of bed. Sometimes ladies, we like just to mobilise you up and down the ward just to make you feel confident. And really that's all you see of us for the first day. On day 2 we will come along and check that you're happy with the exercises that we gave you on day 1, and we'll go through the day 2 exercises, which are mainly for the sort of abdominal area, and go through the ones that are later on in your recovery, so from week 4 onwards. We will give you a booklet which has got all of the exercises in it, so that if you can't remember anything that we've gone through, you've got that to refer back to. So really, from a physiotherapy point of view, that is all that we will be doing with you. But obviously, if you've got any questions that you come to your mind after we have gone, then if you just ask the nursing staff, and we'll be more than happy to come back and answer any of your queries.
No matter what type of reconstruction you undergo, we have a fairly standard regime in terms of how we manage your wounds and scars afterwards. Most wounds have either glue or an adhesive tape applied, and the adhesive tape is best maintained for a period of up to 6 to 8 weeks to support the scar. Once this period is over, again we will instruct you on how to look after your scars in terms of moisturisation and massage. After any reconstructive surgery, you will have scars. Scars are always pink and often tender to start with. They take many months to fade, and occasionally scars can stretch and become lumpy. If you do develop problematic scars, your doctor may recommend certain other types of treatment. For all patients, we recommend early scar massage, and your surgeon or breast care nurse will instruct you on how to perform this.